Just go back a bit about the side effect that we noticing, especially I'm thinking about the My and then RD for a long time, and we have all been user of RD from the first trial. So what are your thoughts, Julie? What are the most common ones that your patient complain about, you're finding? Do you have any tips to share in terms of how to manage them?
Well, I find from an RD perspective, the myalgias, I think, are pretty big for patients. They're those niggly things that they don't always want to mention because they think that it's something they're willing to put up with. But when you ask about it, they're talking about the restless legs and the muscle cramps. I usually tell them magnesium and calcium first thing to start with. That seems to help quite a bit. That's one of the more niggly things with RD.
Yeah, I agree. And fatigue is another.
Yeah.
It's a tough one to try and improve. But I think one of the things is to think about other causes and testosterone level, thyroid, other medications. Oftentimes, assuming nothing shows up, advice to the patient is to increase activity. And I think that helps with muscle cramps at times too.
How much are you decreasing the dose to combat fatigue?
Yeah. I try not to, but if it helps, some patients find that a drop of one dose level will make a difference. And I think if they're responding to treatment, I think that's fine. Yeah.
And probably the diarrhea as well, I would say, right? It's something patients complain fairly often. Oh, and luckily now we know what is causing it is the fact, this bile production get increased with being on land, especially for a long time. So we usually try, I'm sure you also suggest Imodium as well, but we've been using more also cholesterol more often because we have seen big difference in patients. Some they use once a day, some twice a day, but make them definitely improve their quality of life, which again, from a patient point of view, is extremely important.
I agree. I think that's the one side effect that you can really, improve for the patient. And I generally tell them that they may need anywhere from half a package to a few per day, up to 4, and to allow them to adjust it according to how they feel and understanding that the alternate side effect of taking too much is constipation. So generally they can find a dose that works for them.